Have you ever wondered why your sex life changes after 50, even if you still feel young at heart? Maybe intimacy doesn't feel the same. Perhaps your desire isn't what it used to be. Or maybe you're noticing changes in energy, performance, or confidence that no one ever warned you about. Here's the surprising truth. Turning 50 doesn't mean the end of a healthy sex life. In fact, many couples report greater emotional intimacy and sexual satisfaction later in life than they experienced in their younger years. The difference isn't age, it's understanding how your body changes and knowing what to do about it. Today, we're revealing 9 doctor-approved habits that can help support better sexual health after 50. Some of these tips may seem obvious, but one of them so commonly overlooked that it could be quietly affecting your relationship without you even realizing it. Let's begin with the foundation of every healthy sex life: your heart. Many people think sexual performance starts in the bedroom. In reality, it begins in your cardiovascular system. Sexual arousal depends heavily on healthy blood flow. As we age, blood vessels naturally become less flexible, and conditions such as high blood pressure, diabetes, and high cholesterol can reduce circulation throughout the body, including the pelvic organs. For men, reduced blood flow can contribute to erectile dysfunction. For women, it may lead to decreased arousal, vaginal dryness, and increased discomfort during intimacy. This is why doctors often describe erectile difficulties as an early warning sign of cardiovascular disease. Sometimes the small blood vessels that supply the penis show problems before larger arteries supplying the heart. Rather than ignoring these changes, they should be viewed as an opportunity to improve overall health. So what's the first habit? Prioritize your heart. Regular walking, controlling blood pressure, managing cholesterol, maintaining a healthy weight, and following your doctor's recommendations don't just reduce heart disease, they can also support better sexual function. Now here's something many people don't expect. The second habit has nothing to do with medication. It's movement. After age 50, muscle mass naturally declines, metabolism slows, and hormone levels gradually change. A sedentary lifestyle accelerates all of these processes. Regular physical activity increases circulation, boosts energy, improves mood, supports hormone balance, and helps reduce stress. Even 30 minutes of brisk walking 5 days each week can make a meaningful difference. Strength training is equally important. Building muscle helps improve insulin sensitivity, supports testosterone production in men, preserves bone density, and enhances confidence. Women also benefit from resistance training because stronger muscles improve posture, balance, and overall physical well-being. Many people focus only on appearance. Doctors focus on function. A stronger, healthier body is better prepared for an active and satisfying intimate life. Now let's discuss something that often surprises patients: sleep. Most people never connect poor sleep with sexual health. Yet research consistently shows that inadequate sleep affects hormones involved in sexual desire. Men who routinely sleep too little may experience lower testosterone levels. Women may notice decreased desire, mood changes, and increased fatigue. Poor sleep also increases stress hormones like cortisol, making it harder for both mind and body to respond naturally during intimacy. If you're sleeping less than 7 hours each night, improving your sleep habits could have benefits far beyond simply feeling rested. Another important factor is nutrition. Unfortunately, there is no magical food that instantly improves sexual performance, but there are many foods that support the systems responsible for healthy sexual function. A Mediterranean-style eating pattern, rich in vegetables, fruits, whole grains, olive oil, nuts, beans, fish, and healthy fats, supports circulation and reduces chronic inflammation. Foods naturally rich in nitrates, such as leafy greens and beets, help the body produce nitric oxide, a molecule that relaxes blood vessels and supports healthy blood flow. Omega-3 fatty acids found in fatty fish may also support cardiovascular health. Meanwhile, excessive sugar, highly processed foods, and excessive alcohol may gradually damage blood vessels and increase the risk of diabetes and obesity, 2 major contributors to sexual dysfunction. Here's another fact many people don't realize. Certain medications can affect sexual health. Blood pressure medications, some antidepressants, medications for enlarged prostate, and other prescription drugs sometimes influence libido or sexual performance. This doesn't mean anyone should stop taking prescribed medication. Instead, it's a reminder to have honest conversations with your healthcare provider. In many cases, alternative medications or treatment adjustments may be available. Never stop medication without medical guidance. Now let's talk about one of the most powerful factors that medicine cannot replace: communication. Many couples silently assume their partner knows how they feel. But after 50, physical changes, menopause, chronic illnesses, stress, retirement, and family responsibilities can all influence intimacy. Open, respectful communication reduces anxiety, builds trust, and helps couples adapt together rather than growing apart. Sometimes the most effective improvement isn't a prescription, it's simply having an honest conversation. But we're only getting started. In the next part, we'll reveal why hormones aren't always the real problem, explain the exercise many people have never heard of that can improve sexual function, and uncover several everyday habits that quietly damage intimacy without people even realizing it. So far, we've talked about heart health, exercise, sleep, nutrition, medications, and communication. But now we're about to discuss one of the biggest misconceptions surrounding sex after 50. Many people assume that declining hormones are the only reason their sex life changes. The truth is much more complicated. Hormones certainly play a role, but they're only one piece of a much larger puzzle. For men, testosterone levels naturally decline gradually with age. However, many symptoms blamed on low testosterone are actually linked to poor sleep, obesity, diabetes, chronic stress, certain medications, or lack of physical activity. Simply increasing testosterone isn't always the answer, and testosterone therapy isn't appropriate for everyone. That's why proper medical evaluation is essential before considering hormone treatment. Women experience even more dramatic hormonal changes during menopause. As estrogen levels decline, vaginal tissues may become thinner and less lubricated, making intimacy uncomfortable or even painful. Some women also notice reduced desire, while others report no change at all. Here's the encouraging news: many of these issues can be successfully managed. Healthcare providers now have numerous evidence-based options, including vaginal moisturizers, lubricants, pelvic floor therapy, and in appropriate cases, prescription treatments. The most important step is realizing that these changes are common and that help is available. Now let's talk about something almost no one discusses until problems develop: pelvic floor muscles. Most people have never heard of them, yet these muscles support the bladder, bowel, and sexual organs. They also play an important role in sexual function for both men and women. Like every other muscle in your body, they become weaker if they're never exercised. Weak pelvic floor muscles may contribute to urinary leakage, reduced sensation during intimacy, and decreased sexual satisfaction. The good news: these muscles can often be strengthened. Pelvic floor exercises, commonly called Kegel exercises, are simple movements that involve repeatedly tightening and relaxing the muscles used to stop the flow of urine. Performed correctly and consistently, they may improve bladder control and support sexual function in many people. If you are unsure how to perform them, a healthcare professional or pelvic floor physical therapist can provide guidance. Now here's another surprising habit that quietly damages sexual health: chronic stress. Many people assume stress disappears after retirement. In reality, it often changes forms: financial concerns, health worries, caring for aging parents, helping adult children, relationship challenges. All of these increase the body's production of cortisol, the primary stress hormone. When cortisol remains elevated for long periods, it can interfere with sexual desire, reduce energy, disturb sleep, and make intimacy feel like another responsibility rather than a source of connection. That's why stress management isn't a luxury. It's part of maintaining sexual wellness. Simple daily habits such as walking outdoors, practicing mindfulness, deep breathing, reading, gardening, prayer, meditation, or spending quality time with loved ones may significantly improve emotional well-being. And emotional well-being directly affects intimacy. Now let's discuss alcohol. Many people believe a few drinks automatically improve romance. While alcohol may temporarily reduce inhibitions, larger amounts often have the opposite effect. For men, excessive alcohol can interfere with erections and lower testosterone over time. For women, it can reduce lubrication, dull arousal, and interfere with orgasm. Heavy drinking also contributes to poor sleep, weight gain, liver disease, and cardiovascular problems. all of which can negatively affect sexual health. Moderation matters. Smoking deserves equal attention. Few lifestyle habits damage sexual function as consistently as tobacco. Smoking injures blood vessels throughout the body, reducing oxygen delivery and impairing circulation. Since healthy blood flow is essential for sexual response, quitting smoking is one of the best investments a person can make, not only for their heart and lungs, but also for their intimate health. Here's something many couples overlook. Your brain is your most powerful sexual organ. Negative self-image, anxiety about aging, fear of rejection, or worrying about performance can all interfere with intimacy. Sometimes the problem isn't physical at all, it's psychological. As people age, bodies naturally change. Wrinkles appear, muscle mass decreases, weight shifts, scars accumulate. These changes are normal. But comparing yourself to unrealistic images seen online or in media can create unnecessary insecurity. Confidence doesn't come from having a perfect body. It comes from accepting your body while taking care of it. Couples who focus on emotional connection, affection, humor, trust, and shared experiences often discover that intimacy becomes richer, not because everything is physically perfect, but because their relationship becomes deeper. Now here's another fact that deserves attention. Many chronic medical conditions affect sexual health long before people recognize the connection. Diabetes can damage nerves and blood vessels. High blood pressure reduces circulation. Arthritis may cause pain during movement. Obesity contributes to inflammation and hormonal changes. Depression affects both mood and desire. Treating these conditions effectively often improves overall quality of life, including intimacy. Sometimes improving sexual health begins with better management of general health. In the next part, we'll uncover several silent diseases that often affect sexual performance without obvious symptoms. Explain why routine medical checkups become increasingly important after 50, and reveal one daily habit that many doctors believe has one of the greatest long-term impacts on sexual wellness. By now you've learned that better sexual health after 50 isn't about finding a miracle pill. It's about improving the systems that keep your body functioning at its best. But there's one important question we haven't answered yet. What if your sex life is trying to warn you about a hidden health problem? This may sound surprising, but doctors often say that changes in sexual function can be one of the body's earliest warning signs that something else isn't right. Let's start with diabetes. More than 1 in 3 adults over 50 are living with diabetes or prediabetes, and many don't even know it. Over time, high blood sugar damages blood vessels and nerves throughout the body. Since sexual function depends on healthy circulation and proper nerve signaling, diabetes can gradually interfere with both. For men, this may appear as difficulty achieving or maintaining an erection. For women, diabetes may contribute to reduced lubrication, decreased sensation, and an increased risk of infections that make intimacy uncomfortable. The problem is that these changes often develop slowly. Many people assume they're simply getting older, when, in reality, an undiagnosed medical condition is silently progressing. This is why regular blood sugar testing becomes increasingly important after age 50. Now let's talk about blood pressure. High blood pressure is often called the silent killer because it usually causes no symptoms until serious damage has already occurred. But before it affects the heart or brain, it can begin damaging the tiny blood vessels responsible for healthy sexual function. When blood vessels become stiff and narrowed, blood flow decreases. That doesn't only increase the risk of heart attack and stroke, it can also make intimacy much more difficult. The encouraging news is that controlling blood pressure through healthy eating, regular exercise, stress management, and prescribed medications benefits your entire body, including your sexual health. Another silent condition many people overlook is high cholesterol. Cholesterol itself doesn't cause pain. You can't feel plaque building inside your arteries. But over many years, fatty deposits gradually narrow blood vessels, limiting circulation to every organ. Healthy arteries support healthy intimacy. Blocked arteries do the opposite. That's why your annual cholesterol check is about much more than preventing heart disease. It's also part of protecting your long-term quality of life. Now let's discuss something that many people feel embarrassed to bring up: weight gain. After 50, metabolism naturally slows. Muscle mass decreases. Hormonal changes make it easier to gain fat and harder to lose it. Extra body fat, especially around the abdomen, is associated with increased inflammation, insulin resistance, lower testosterone levels in men, and higher risk of cardiovascular disease. For women, obesity can worsen menopausal symptoms, joint pain, and fatigue. Even modest weight loss can produce meaningful health benefits. Research shows that losing just 5 to 10% of body weight may improve blood pressure, blood sugar control, energy levels, and overall physical function. The goal isn't chasing a perfect body. The goal is creating a healthier one. Now here's a daily habit that's often underestimated. Hydration. Water may seem unrelated to sexual health, but it plays an important role in circulation, energy production, temperature regulation, and overall body function. Even mild dehydration can contribute to fatigue, headaches, dry mouth, and reduced physical performance. For women, staying well hydrated may also help support normal tissue health, although hydration alone isn't a treatment for vaginal dryness. Replacing sugary beverages with water throughout the day is one simple habit that supports overall wellness. Now let's talk about another issue many adults never expect: loneliness. As people age, retirement, the loss of loved ones, children moving away, or changes in relationships can increase feelings of isolation. Loneliness doesn't just affect emotional health. Research has linked chronic loneliness with higher levels of stress hormones, poorer sleep, increased inflammation, depression, and even higher risks of cardiovascular disease. Healthy intimacy begins long before the bedroom. It begins with emotional connection. Holding hands, laughing together, sharing meals, talking without distractions, showing appreciation. These small daily moments strengthen relationships in ways that physical intimacy alone cannot. For couples, emotional closeness often becomes even more important after 50. Now here's another important point. Don't ignore persistent symptoms. Many people delay seeing a doctor because they feel embarrassed discussing sexual concerns. But healthcare professionals talk about these issues every day. Difficulty with erections, pain during intercourse, loss of desire, persistent vaginal bleeding, penile pain, changes in ejaculation, pelvic discomfort. These symptoms deserve medical attention, especially if they develop suddenly or continue over time. Sometimes the cause is simple and easily treated. Other times these symptoms may signal diabetes, cardiovascular disease, hormonal disorders, thyroid disease, depression, medication side effects, or other conditions requiring evaluation. Early diagnosis often leads to better outcomes. One conversation with your healthcare provider could uncover a problem before it becomes much more serious. Here's something many people never hear. A satisfying sex life isn't measured by frequency, it's measured by comfort, communication, mutual respect, emotional connection, and overall well-being. Every couple is different. Comparing your relationship to someone else's, or to unrealistic portrayals on television or social media, creates unnecessary pressure. Focus on what feels healthy, enjoyable, and meaningful for you and your partner. In the final part, we'll reveal the last doctor-approved habits that can make a lasting difference after 50, discuss when it's appropriate to seek professional treatment, and summarize the simple daily routine that supports not only a healthier sex life, but a healthier, happier future overall. Throughout this video, we've uncovered something many people never hear from their doctors. Growing older doesn't mean giving up on intimacy. In fact, many adults discover that their most meaningful and satisfying relationships happen after 50. Not because their bodies are perfect, but because they finally understand how to take care of them. Now it's time to reveal the final doctor-approved habits that can make a real difference. The first is something incredibly simple, yet often overlooked. Don't ignore routine medical checkups. Many people only visit a doctor when something feels seriously wrong, but sexual health problems often develop slowly. Conditions like diabetes, high blood pressure, high cholesterol, low thyroid function, hormone imbalances, enlarged prostate, and even early heart disease may begin affecting sexual health long before they cause obvious symptoms. Annual checkups allow your healthcare provider to identify these problems early, when they are often easier to manage. Simple blood tests, blood pressure measurements, cholesterol screening, blood sugar testing, and routine physical examinations can reveal issues that might otherwise go unnoticed for years. Think of these appointments as preventive maintenance for your body. Just as you service your car before it breaks down, Your body deserves the same attention. Now let's talk about another habit that can transform intimacy after 50. Keep your relationship emotionally healthy. Many couples spend years focusing on work, raising children, paying bills, and caring for others. Then suddenly, after retirement or when children leave home, they realize they no longer know how to reconnect. Physical intimacy rarely exists without emotional intimacy. Simple daily habits matter. Sit together without distractions. Take evening walks, share meals, express gratitude. Laugh often. Listen without interrupting. Show affection through small gestures like holding hands or a warm hug. These moments strengthen trust, reduce stress, and naturally create a stronger emotional bond. Many relationship experts agree that emotional closeness is one of the strongest predictors of long-term sexual satisfaction. Now let's address a question many viewers may be wondering. Should you use sexual enhancement supplements? The internet is filled with advertisements promising instant results. Miracle pills, herbal formulas, natural performance boosters. Unfortunately, many of these products lack strong scientific evidence, and some have even been found to contain hidden prescription drugs or harmful ingredients not listed on the label. That's why it's important to approach supplements with caution. Just because something is marketed as natural doesn't automatically mean it's safe. Some supplements may interact with medications for heart disease, blood pressure, diabetes, or other chronic conditions. Before taking any supplement advertised for sexual performance, speak with your healthcare provider or pharmacist. Evidence-based medical care is always safer than marketing promises. Now let's discuss prescription treatments. Many people feel embarrassed asking their doctor about erectile dysfunction, vaginal dryness, low desire, or discomfort during intimacy. But healthcare professionals understand these concerns. Effective treatments exist for many conditions: prescription medications, pelvic floor physical therapy, hormone therapy, in carefully selected individuals, counseling, and other medical interventions have helped millions of people improve their quality of life. There is absolutely no shame in asking for help. In fact, seeking medical advice is one of the healthiest decisions you can make. Now here's something that deserves special attention. Mental health. Depression and anxiety become more common with age, particularly after major life changes, such as retirement, chronic illness, loss of loved ones, or financial stress. These conditions don't just affect mood, they influence sleep, energy, hormones, motivation, relationships, and sexual desire. If you've lost interest in activities you once enjoyed, feel persistently sad, anxious, or emotionally exhausted, don't ignore those feelings. Mental health is healthcare. Treating depression or anxiety often improves many aspects of life, including intimacy. Let's review the 9 doctor-approved habits we've discussed today. First, protect your heart because healthy circulation supports healthy sexual function. Second, stay physically active with regular exercise and strength training. Third, prioritize quality sleep every night. Fourth, eat a balanced diet rich in vegetables, fruits, healthy fats, whole grains, and lean proteins. Fifth, strengthen your pelvic floor muscles and care for your overall physical health. Sixth, reduce stress while protecting your emotional well-being. Seventh, avoid smoking and limit excessive alcohol consumption. Eighth, communicate openly with your partner and maintain emotional closeness. And finally, never ignore persistent symptoms or skip regular medical checkups. Notice something interesting. None of these habits are only about sex. Every one of them improves your overall health. That's because sexual wellness isn't separate from the rest of your body. It's a reflection of it. Healthy blood vessels, healthy hormones, healthy muscles, healthy relationships, healthy minds. They all work together. If one area begins to suffer, the others often follow. But the opposite is also true. When you improve your overall health, your confidence grows, your energy improves, your relationships become stronger, and intimacy often becomes more enjoyable as a natural result. Remember, getting older isn't something to fear. It's an opportunity to care for your body in smarter ways than ever before. Many adults in their 50s, 60s, 70s, and beyond continue to enjoy active, fulfilling relationships because they prioritize their health instead of believing the myth that aging automatically ends intimacy. The choices you make today can influence how you feel for years to come. So don't wait until problems become overwhelming. Start with one healthy habit this week. Take a walk. Schedule that overdue checkup. Choose a healthier meal. Get an extra hour of sleep. Have an honest conversation with your partner. Small steps, repeated consistently, often create the biggest changes over time. If you found this video helpful, be sure to like it, subscribe to the channel, and turn on notifications so you never miss our latest evidence-based health videos. And here's a question for you. Which of these 9 habits do you think could make the biggest difference in your life? Share your thoughts in the comments below. Your experience could encourage someone else to take the first step toward a healthier, happier future. Thank you for watching. And remember, it's never too late to invest in your health, your relationship, and your quality of life. Until next time, stay healthy and take care of yourself.